Yo, what's good? Listen, this video right here is gonna teach you a little bit about gonorrhea and chlamydia. Ooh, it can go undetected too. If you wait too long, it can stop you from being able to have kids, can cause pelvic inflammatory disease, all type of stuff. The longer you wait, the more it messes you up. Be sure you go get tested now. Wouldn't want to wait too long.
Of the many sexually transmitted infections, or STIs, gonorrhea is the second most common. The most common STI is chlamydia. And we'll talk more about chlamydia later. Right now let's focus on gonorrhea and why these two happen together. These two diseases often occur together for two reasons. First, they have similar risk factors, which include things like having multiple sexual partners and or having frequent unprotected sex. The other reason is that infection with one of these bugs makes your body susceptible to a second infection by dampening the immune system. So I promise we'll go into more detail about chlamydia later, but for now let's talk more about gonorrhea. It's caused by a bug referred to as Neisseria gonorrhoeae. And the reason why we call gonorrhea a sexually transmitted infection is because it undergoes this process referred to as transmission, where it moves from one person to another by several mechanisms. Most commonly, gonorrhea will be transmitted through sex, which can include oral sex, vaginal sex, or even anal sex. Another important mechanism of transmission includes childbirth, and we'll talk more about the outcomes of that in a minute. So these are the main ways that gonorrhea can be transmitted. So let's move this off to the side, and let's focus instead on my poor friend over here, who's going to have all the different signs and symptoms a person can get with gonorrhea. Now, because we said the main way gonorrhea spreads from one person to the other is by sex, let's start by focusing on signs and symptoms at our sexual organs. So here you can see, on the left I have female genitalia drawn out, and on the right side we have male genitalia drawn here. So if we were to imagine our gonorrhea infection, so I'll use this as sort of a way to mimic gonorrhea as it spreads. Perhaps you can have a female infecting a male with gonorrhea, and so because the penis is used during sex, that can actually seed or spread up the urethra. So this yellow line here, that is your urethra. And we'll go into this in more detail in another video, but the gonorrhea bacteria will latch on to the walls in your urethra. Your urethra is lined by epithelial cells, and so this bacterium will enter those cells. That will trigger an immune response. Your white blood cells will detect that something is wrong, and they'll come up to the urethra through the bloodstream to attack wherever the gonorrhea has spread. So if the gonorrhea has only entered a single epithelial cell in your urethra, it'll cause that cell to die in a process that's referred to as apoptosis. Maybe you've heard of it. It's where the body specifically decides to kill a cell because it's doing something wrong or it's been infected, like in this case. Now, in the ideal world, the white blood cell will kill off this one epithelial cell in the urethra that's been infected, and we'd be done with the infection. But oftentimes there are multiple organisms that kind of spread along the urethral tract, which cause more white blood cells to come from the bloodstream to attack the bacteria or the cells that are infected. And as a result, you get inflammation. Inflammation of the urethra, causing things like pain when you urinate, maybe some burning that's there as well, and general discomfort. So because of the bacterium, your urethra will cause you a lot of pain, and you've got what's referred to as urethritis. If the gonorrhea spreads up here to your prostate, this pink thing is your prostate, you can get what's called prostatitis. And this inflammatory process that's occurring along the way causes white blood cells that may die and epithelial cells that will also undergo apoptosis with some of the gonorrheal bacteria to slough off and fall through and come out from the urethral meatus, or the end of the penis. And you can actually see pus coming out of the penis. Now, just like the epithelial cells within your urethra, gonorrhea can also affect the epithelial cells that line the anus, or even higher up here in the rectum. As a result, you might not see pus coming out from the anus, and instead you might see infections of the cells that line the anus or of the anus. So this skin infection you'd see here are referred to as pustules. Pustules. And again, that's from the gonorrheal bacteria infecting the epithelial cells of the anus. You can also have pustules occur in the female, so let's label that right here, as well as urethritis. But because of the difference in anatomy between the male and the female, you may also see an infection of the vagina, or vaginitis. More commonly, though, infected women will have pain during sex because of pressure that's put on the cervix, due to the gonorrhea that's spread there, causing cervicitis. Cervicitis. Gonorrhea can spread even further up from the cervix through the uterus and actually come out the fallopian tubes to cause an infection within the pelvic cavity, which is why it's called pelvic inflammatory disease. Pelvic inflammatory disease, or PID. Now, from the genital tract, gonorrhea can spread into the bloodstream and go elsewhere in the body. And quite classically, it goes to your joints, like the knee over here, to cause arthritis by infecting the joint capsule. So down below here, you can see the joint capsule. Here's bone, here's articular cartilage, and this is synovial fluid, or just some fluid in between the two bones and the joint. So if gonorrhea spreads here, think about what else is going to come right after it. White blood cells. Remember, they're going to come chasing after the gonorrhea, and they're going to cause inflammation. And if you notice in this picture, there's not a lot of space between the two sets of articular cartilage and the bones here. So if too many white blood cells get into the synovial cavity and cause inflammation, you're going to have a more difficult time using that joint, which leads to pain in the knee and difficulty walking. Left untreated, gonorrhea can also spread to the central nervous system. Gonorrhea can infect the lining around the brain and the spinal cord. This lining is referred to as the meninges. And an infection of the meninges is referred to as meningitis. And unfortunately, gonorrheal meningitis is more common in children than it is adults. And speaking of children, I mentioned earlier that you can spread gonorrhea through childbirth. An infected mother can spread the infection, if undetected, to her child. And very early on, you would know if a child is infected with gonorrhea if they look like this. You'll notice that the baby may have this very signature crusting of the eyes that's referred to as gonococcal ophthalmia, which is just to say that you have an ophthalmic or an eye infection of gonorrhea. This baby can also have a variety of other issues related to the gonorrhea, such as meningitis, as we talked about, or even pneumonia, which is why Neisseria gonorrhoeae, or gonococcus, is one of the bugs pregnant women are often screened for and treated for before they give birth, to decrease the odds of this sort of thing happening. Gonorrhea is caused by a bacterial organism called Neisseria gonorrhoeae. Now that's kind of a long name, so it's actually more commonly referred to as gonococcus, where gono just comes from its name, and then coccus actually just means a sphere or a ball. And in fact, gonococcus has a very distinct shape, where it's like a pair of two balls that travel together. And that's, as we'll see in a minute, what the bacterium that causes gonorrhea looks like. Now, if we look at the part of the body that's mainly affected here, in the case of the female, you'll see here's the urethra that leads to the bladder, here's the vagina that leads up to the cervix and the uterus, and here's the anus that leads up to the rectum. Now let's use this picture to talk about the pathophysiology of gonococcus. The pathophysiology, or in other words, how gonococcus causes symptoms in a patient. So it first starts when the gonococcus is spread into the vagina this way, and it kind of makes its way upward to infect the walls of the vagina and eventually the cervix over here. But let's take a closer look up here to see how gonococcus makes its way up here. So here you'll see a blown up picture where you have the cervix and the walls of the vagina that lead up to it. And we know that gonococcus will enter into the vagina and somehow spread its way upward. Well, the way that works is because of these extensions that come off of the gonococcus. One of these is called a pilus. A pilus. Or if we're talking about many of these at once, they're referred to as pili. Pili. The pilus will allow the gonococcus to grab onto the wall. As you'll see, there's a bunch of epithelial cells here that line the vagina. The pilus will work like a grappling hook, so it'll snap the gonococcus upward towards the cervix, allowing it to move deeper into an infected person. So generally, it'll go upward. But remember, the body has an immune system that's supposed to prevent the gonococcus from going further and further into an infected person. So what I've drawn here is a white blood cell. This white blood cell will look for the gonococcus and actually swallow it. So you'll see a lot of these gonococcus or gonococci, that's how you say the plural version of them. Many of these gonococci will be inside the white blood cell. And I'll leave off drawing the pili for now, and instead highlight this very interesting feature about gonococcus. Now remember, whenever white blood cells come and swallow up these bacteria, we're trying to process the proteins that are on these organisms so we can develop antibodies or other ways that we can attack the bacteria if they ever infect us in the future. This process of the body remembering an infection in the past and acting on it in the future is referred to as immunologic memory. Immunologic memory. Now, the interesting thing about gonococcus is that no matter what the body does, it can't develop immunologic memory against it. And the reason why is because when white blood cells try and swallow the gonococcus over here, they try to latch onto them with these things, these receptors right here. And these are called OPA receptors, OPA. OPA receptors. These guys help kick off the process of developing immunologic memory. And the reason why they don't work on gonococcus is that they have this protein on them. And I'll just draw it as like a little wedge or a triangle here. This protein that's referred to as an OPA protein that will bind these receptors and prevent them from working. Which is why every time a person is infected with gonococcus, they have to go through the process of attacking the bacteria as if it's a new type of infection all the time. Okay, so now that we know some of the tricks that gonococcus can use to infect us, what are some of the tricks that we can use to help in the diagnosis of gonorrhea? Well, the first thing that's usually done is that a swab is taken to get a sample of the bacteria that may be infecting the patient. So when you get a better look at this swab right here, you'll see that it'll have some streaks of cells from the vaginal mucosa. There might be some mucus in there, and something that we can't see that we hope is there are some traces of the gonococcus bacteria. So in order to study it, what we need to do is take this swab and smear it on a microscope slide. When we do that and we take a look with a microscope, we can add extra stains to the microscope slide in a process that's referred to as gram staining. So we can gram stain the slide to see what kind of organisms we have underneath there. So when we look under the microscope, we might see this. This is what's referred to as a polymorphonuclear cell, or also it's known as a neutrophil. And you can see 3 neutrophils in this slide right here. This neutrophil in particular has swallowed a ton of gonococci. I mean, I can circle a ton of them right here. And so the way we would describe this gram stain would be as gram-negative cocci, which just means that the bacteria that we're seeing here are coming up as red, which refers to a negative retention or no retention of the gram stain, as well as cocci, which just means that we're seeing spheres. A coccus just means a sphere, but there's not just one of them individually, they're in pairs. So we say that we see here gram-negative cocci in pairs. And if you see this, it's classic for a gonorrhea infection or for gonococcus. Usually this is all we need to do to make our diagnosis, especially with the constellation of symptoms that a patient will have. But another step we can take, and I'll draw it right here, is to take the swab and smear it on this petri dish. So this petri dish right here. And what that allows us to do is that we'll put our swab here and we'll smear the sample we got from the patient, and we'll let it grow over a few days. And we may see this. Now this is a petri dish that we've grown some bacteria on, so we refer to this process as a culture. So we've cultured the swab or the specimen that we took. And what you're seeing here are colonies of the Neisseria bacterium or the gonococcus that's growing wherever there are bumps here. Now, there are a bunch of different culture media or environments that you can grow the sample on. This one in particular that's very specific to Neisseria organisms is referred to as a Thayer-Martin medium. That means if you see anything grow on a Thayer-Martin medium, that's a pretty slam dunk diagnosis for some type of Neisserial infection. So after we make our diagnosis, how are we going to treat it? Well, the mainstay of treatment for any gonorrhea infection will be antibiotics. And we can actually check when we're culturing our sample for what antibiotics will work best. So say we have a certain antibiotic, we'll call it antibiotic number 1 here, and we'll have antibiotic number 2 up here. As you can see in our culture down here, antibiotic number 1 seemed to not have any gonorrheal bacterium growing here at all. So that means it works to kill off the gonococcus. Whereas up here, antibiotic number 2 didn't really do a good job, because we're still seeing a lot of these bumps growing, or a lot of these gonococci growing. So one of the tricks we have up our sleeve here is that we can use the culture to identify specific antibiotics that work. Now, what about prevention? How do we make sure that we don't spread gonorrhea from one person to another? Well, gonorrhea mainly lives within human hosts. So the most successful strategy, as with many infections, will be to prevent transmission. The most common way that gonorrhea is spread is through sex. And that can include vaginal sex, anal sex, or even oral sex. To prevent transmission from vaginal or anal sex, you have to limit the amount of direct contact that occurs during intercourse, and the best way to do that would be through condoms. Now that can also work to prevent transmission during oral sex, but another device that works well are dental dams. And finally, the last way that you can spread gonorrhea is from a mother who's infected to her newborn during childbirth. And actually the method of preventing transmission here is just to treat the mom, which again would be through using antibiotics. And because gonococcus lives predominantly in humans, by preventing the transmission of this disease, we can actually move in the direction of eradicating it altogether. Chlamydia is the most common sexually transmitted infection in the world. Sexually transmitted infection. And you might recall from our conversation about gonorrhea, chlamydia often co-infects with gonorrhea, or they tend to occur together. Now, there are several species of chlamydia that exist, but when we talk about the most common STI that's responsible for the disease chlamydia, we're talking about chlamydia trachomatis. Trachomatis. And the way it gets this name, trachoma, is the term for the eye infection that occurs with chlamydia, as we'll talk about in a minute. Now, with any sexually transmitted infection, we have to consider the mechanism by which the infection spreads from one person to another, and that process is called transmission. And there are several ways that chlamydia is transmitted from one person to another. Sex is the most common way, and that can include oral sex, vaginal sex, and anal sex. Childbirth is another important mechanism for transmission, as we'll talk about in a few minutes. And finally, one of the unique ways that we can transmit chlamydia that we can't with many other sexually transmitted infections is with direct contact. Now, I want to throw a big asterisk over here, because chlamydia can only live outside of a human host for about a few seconds to a minute. So direct contact means something like scratching an infected organ of the body, say part of the genitalia, and then directly touching another part of the body like the eye. This doesn't count for one person touching another person directly and spreading the infection. That's very rare and unlikely to occur. Direct contact means to spread from a person to another part of that same person's body. And we'll talk about that in the case of conjunctivitis or an eye infection of chlamydia. So now let's move this list off to the side and focus on my poor friend right here, who's going to have all the different signs and symptoms you can get with chlamydia. Now, as I mentioned already, chlamydia is mainly spread through sex, so why don't we start by focusing on the sexual organs right here, which I've drawn out already. And I want to label this side as the female. So right here is the urethra. Right here is the entrance to the vagina, which leads up here to the cervix, And I won't label it here, but this is the anus, and this leads up to the rectum and the rest of your lower gastrointestinal tract. And on this side, we have the male that starts with the penis, the testicle, the prostate, the bladder, the urethra, and I'll label the rest of this in a minute. But let's focus here on the female. Now, let's say, for instance, that this female is infected by a male, and so here's a chlamydia trachomatis bacterium that's making its way into the vagina. And I'll just label this as our key up here. That's what I'm going to draw chlamydia to look like. And from here, the chlamydia will multiply and spread further up the genital tract on its way to the cervix. And the same thing can occur with the urethra nearby. Perhaps we can have chlamydia spread up this way and into the urethra. And the interesting thing about chlamydia is that it's predominantly an intracellular organism or an intracellular bacterium, which just means that it likes to live within a cell, which in this case means the human host cell, or the epithelial cells that line the vagina, or the epithelial cells that line the urethra. Now, the symptoms that we have that are associated with chlamydia are due to the white blood cells that come and attack the bacterium. What they do is that they'll notice that there are chlamydia inside of these epithelial cells, and they will target the cells that are infected to cause a process that's called apoptosis. Apoptosis, which is the very neat and organized killing of a specifically selected cell. So I'll write here cell death. So it's cell death that is programmed by the white blood cell. Now, as I've drawn here, we usually don't have a single chlamydia bacterium that comes to infect the genital tract or the urinary tract. You're going to have many of these guys that are inoculated or spread into the tract. So there's going to be, as a result, a lot of white blood cells that come from the bloodstream to the genital or the urinary tract to attack the infected epithelial cells or any chlamydia they can eat up that's outside of the cells at the time. And when all these white blood cells show up from the bloodstream and go to the genital or the urinary tract where they're not supposed to usually be, we get this process of inflammation. Inflammation. And that's what causes us the swelling, the burning, and the general pain that's associated with a chlamydia infection. That means that at the urethra, when it gets infected, you have urethritis. Urethritis. And the burning sensation you have when you pee is called dysuria. Dysuria, which just means urea, referring to the urinary tract, and dys meaning some complication or something that's out of whack or has a disorder. Dysuria. The same can be said for an infection of the epithelial cells that line the vagina, resulting in vaginitis. Or if they go further up here to the cervix, you get cervicitis. Cervicitis. And just like there's a term for painful urination, there's a term for painful sex or intercourse, and that's called which means disorder again, pareunia. Dyspareunia, where pareunia just means the act of intercourse or sex. Now, there are a lot of similarities that you can draw here in the case of the male. So say if we have some of the chlamydia bacteria spreading up the urethra, that'll cause urethritis. Or if it spreads up here to the prostate, this pink guy over here, that's the prostate, you can get prostatitis. Prostatitis. Now, the one thing I should mention that's different in the case of the female versus the male is that there's an opening from the uterus into the abdominal cavity through the fallopian tubes. And so if the chlamydia spreads so far up through the cervix into the uterus and out the fallopian tubes, they can actually seed or spread into the abdominal cavity. And this happens as well with gonorrhea, and the term we use for this type of infection is called pelvic inflammatory disease. Pelvic inflammatory disease, or PID. And there are several other complications that can occur because of having PID, and we'll talk about that in a separate video. And I've run out of space to show it here, but another very telltale sign of a sexually transmitted infection, especially when white blood cells are coming from the bloodstream to attack the infected epithelial cells and the bacteria, you're going to have that apoptosis or that cell death that occurs along the way. And so the dead epithelial cells, the dead white blood cells, and even the bacteria will come out of the tip of the penis from the urethra or from the urethra in the female. And what you'll actually see is pus. So you're going to have what can also be referred to as a creamy, purulent discharge, or just pus, that represents the dead white blood cells, epithelial cells, and bacteria that are being essentially peed away. Now, from the genitals, chlamydia can spread into the bloodstream to go elsewhere in the body, and there are a couple of very classic places it shows up. One place it can spread from the bloodstream, right here, is the eye. So I've drawn this gentleman's eye down over here, and he's looking downward. And remember, as I mentioned just now, in addition to spreading from the bloodstream, chlamydia can also spread from direct contact into the eye. Let's say if there's some pus that's discharged and a person is confused about why that's coming out and they touch it with their finger and then rub their eye, you can directly spread chlamydia into the eye. And it starts by affecting this reddish portion right here, and that's called the conjunctiva. The conjunctiva, which is just a fancy name for the inside of the eyelid. Now, if the chlamydia spreads here, what you're going to start seeing are these bumps that occur on the conjunctiva, on the inside of the eyelid. And these bumps will accumulate and start scratching on the eye. And when they scratch on the eye, they're going to start causing irritation here as well. And so the conjunctiva, which is infected, can be referred to as conjunctivitis. But once you start irritating the white of the eye over here, you may actually even spread the infection over the pupil here to cause what's called an opacity, which just means this whitening over the pupil that makes it difficult for you to see. And this is what is referred to as trachoma. Trachoma, which is the most common cause of blindness in the developing world. Another site that can be affected from the bloodstream are your joints. So this knee right here can be infected. So we refer to this specifically as infective arthritis. Infective arthritis. All right, arthritis here a little more in the middle. Infective arthritis, which is exactly what you would imagine. The chlamydia spreads from the bloodstream into your joint capsule right here. This white layer is bone. Here's bone as well. And this gray portion is the articular cartilage, or the cartilage that separates the bones from each other. And in between, in the joint capsule, or this synovial cavity, is this fluid. It's referred to as synovial fluid that sort of helps the bones move on top of each other smoothly. So remember, as chlamydia makes it into any part of the body, not just in the joint, but also the urethra, you're going to have white blood cells that come right after it. And these guys are chasing it with a vengeance, and so you're going to have those telltale signs of inflammation occurring here in the joint as well. And I'm sure you can imagine that having a ton of white blood cells here within the joint makes it very difficult for you to have smooth movement if, in addition to the fluid, you've got these white blood cells, and now you've got some chlamydia that's here. You're going to have a lot of pain and difficulty moving. And the term for painful joints is dysarthria. Dysarthria, which dys again means some type of disorder, and arthria refers to the joint. Dysarthria. Now, a unique thing about chlamydia is that in addition to infective arthritis, you can also have something that's referred to as reactive arthritis. Reactive arthritis. And this is a very distinct beast from infective arthritis, in that reactive arthritis is the result of the antibodies that you make. So I'll just write AB for antibodies. The antibodies that you're supposed to make against the chlamydia, which for some reason in this case will attack both the chlamydia trachomatis as well as the joint for some reason. So reactive arthritis is the result of antibodies that are supposed to attack the chlamydia for some reason mistaking proteins in the joint for the same proteins that are on the chlamydia and traveling to the joint to attack it as well. And when antibodies flow into some space, the similar thing happens as what we saw here. With infective arthritis, white blood cells will also rush to the site to help the antibodies attack whatever it is they're attacking. And unfortunately, in this case, those include proteins that are naturally found in the joint capsule. This is a really unusual phenomenon that occurs, and it's sometimes associated with chlamydia, and in fact has its own name or syndrome. This is called Reiter's syndrome. Reiter's syndrome. And it can be best remembered by this popular mnemonic, where if you have Reiter's syndrome, you can't see because you've got trachoma, like you do here. You can't pee because you have urethritis. And then on top of that, you can't even climb a tree because you've got reactive arthritis. Now, in addition to Reiter's syndrome, if you have an infected mother, she can spread chlamydia to her newborn child and have something like this occur. And this is referred to as neonatal chlamydia. Neonatal chlamydia. And first off, you might notice here the crusting of the eye, which is similar to something we already talked about. This is conjunctivitis. But you can also see pneumonia in an infected newborn. And depending on how much the chlamydia will multiply and spread to the baby in the uterus, you may also have premature labor, so the baby will be delivered earlier than they should be, or even death, which is why it's important for pregnant women to be checked for chlamydia, because this disorder can be completely preventable. Pathophysiology is the study of how a disease occurs. And so if we're talking about the pathophysiology of chlamydia, we're talking about how this bacterial organism hijacks the cells of our body to multiply and cause an infection. Now, the unique thing about chlamydia is that it's not a very powerful organism that carries a lot of its own nutrients. It relies on the nutrients of the host cell that it infects, which means that chlamydia must live inside of the host cell in order to reproduce and survive. So the way I'm going to start off designating chlamydia will be in green. So this initial green dot right here actually has a very fancy name. This is referred to as an elementary body. An elementary body, which is just a fancy way of saying it looks like a dot. So the first step of chlamydia infecting our body is that it needs to somehow enter a cell. And the way that works is because of our white blood cells. So I'll draw this guy right here, make him look rather ferocious with these red teeth right here. Now this white blood cell is similar to most cells in our body in that it has a nucleus. So I'll draw this nucleus up here. And this is where all the genetic information for the cell on how to survive and make proteins is stored. So when a white blood cell sees this elementary body, this unusual particle that shouldn't exist in our body, it wants to eat it. And this process by which this white blood cell swallows the elementary body or any foreign particle is referred to as phagocytosis. Phagocytosis. Where if you've heard this term before, you might recognize that cyte just means cell, and phago is just a fancy way of saying to eat. So this cell is eating this elementary body, and after a nice big gulp, you'll see that the elementary body is now contained within this vesicle. We can also refer to it as a phagosome. A phagosome. Some just means a body that has been eaten. Phago. And I just want to point out, I know I drew it as a cartoon here, but the teeth are actually the cell membrane lining of the white blood cell that sort of envelops around the elementary body to turn it into this pocket, this phagosome within the cell. Now, once the chlamydia elementary body is within the white blood cell, it's game time. Now, it uses whatever nutrients it has within this dinky little dot. And let me just redraw the white blood cell right here. This dinky little dot will convert from an elementary body to this guy that looks like a star. And because it looks like a star, scientists refer to this as a reticulate body. A reticulate body. And that's just a fancy way of saying reticular or reticulate means a star. Now, once the chlamydia has turned into a reticulate body, it's going to use the nutrients the white blood cell has. So here's our white blood cell, and the phagosome that I'm going to purposely draw larger. And the phagosome will have a lot of reticular bodies because these will start using the proteins and the machinery that the cell has to reproduce itself with binary fission, meaning it just splits in half. So I'll write that term over here. This is using binary fission, where you take something that grows and just cut it in half, and now you've got two smaller versions of it. Binary fission. And while all this is happening, we're directing nutrients the cell should have been using to fortify its cell membrane, to get nutrients from the outside towards the chlamydia. So you'll notice that it doesn't look like it's doing too well. I'll draw the nucleus very small to indicate that it's not having a great time here. And once we've made enough reticular bodies and we've reproduced enough, the chlamydia will decide that it's time to infect another cell. So here's our white blood cell again. And I'll draw an even larger endosome. It's ridiculous how big it is. And there are these reticulate bodies that are here still that we have reproduced. But in addition to the reticulate bodies, we've started making elementary bodies, these infectious forms of chlamydia. So the elementary bodies are the infectious version of chlamydia. The reticulate bodies are the growth versions of chlamydia. That's a good way to think about it. And so these guys start mass producing within the cell. And the cell is not having a good time now. It is basically on the verge of death because we're not using our nutrients to fortify and grow this cell membrane or to generally help it survive. So as a result of this, the cell will literally pop. It'll burst open and rupture. It will rupture and therefore die, causing the reticulate bodies that we're converting, as well as the majority of the chlamydia organism now in elementary bodies, to be released into the extracellular matrix, to be released outside of the cell. And you'll have some reticulate bodies, of course, but you're going to have a majority of elementary bodies. That can be picked up again by another white blood cell, and we can repeat this cycle. Another variant of this you might see is instead of a white blood cell swallowing up these elementary bodies, you might have an epithelial cell. So I'll write epithelial cell here, like the epithelial cells that line the vagina or even line the urethra, that can swallow the elementary bodies by a process known as endocytosis, which is really just an umbrella term for phagocytosis. Phagocytosis is a type of endocytosis, and doing that will produce an endosome. And the rest of the cycle is all the same, especially the very unfortunate outcome right here. So this is how chlamydia will spread from cell to cell and make its way further up the genital or the urinary tract. Let's say we have this gentleman right here, and I've drawn out his genitalia. This is the penis, the testicle, the prostate, the bladder, and the rectum above the anus. And we suspect that they might have chlamydia. They may have contracted chlamydia. How would we go through and diagnose that? Well, there are a couple of tests that we could use right off the bat to aid in our diagnosis. And in order to do any of these, we need to get a sample. And so if this gentleman here is infected and we're suspecting chlamydia, there may be some chlamydia reproducing and growing up his urinary tract. And so what we need is a swab sample. So we would swab right here from the tip. So let's imagine that there's a little bit of a sample here we've collected. And we can use a couple of tests to figure out if chlamydia is there. The first test we can use would help us look for chlamydia DNA. So I'm going to draw a strand of DNA right here. And as you might imagine, there's going to be a little bit of that present on this cotton swab that we've collected here. And we can't really see if there's any chlamydia if we've only got this small amount of DNA or this nucleic acid. And so what we'd want to do is multiply the number of nucleic acid samples that we have from this cotton swab. And once we do that, we have enough genetic material or nucleic acid that we can actually detect with probes. And this process of multiplying or amplifying the amount of nucleic acids we have from the chlamydia is done using a polymerase chain reaction. Maybe you've heard of PCR before. And to use this test to diagnose chlamydia is called a nucleic acid amplification test. A nucleic acid amplification test, or it's also referred to as an NAAT. Now this test is great because not only is it fast, but it's also more sensitive. So more sensitive, I'll just write SN here. More sensitive and more specific. So I'll write SP, more specific than other tests. Which means we're less likely to have false negatives if it's very sensitive, and we're less likely to have false positive if it's very specific. So it makes sense that this test is the most common one that we use to diagnose chlamydia. Another test that can be used is a traditional gram stain. And we've talked about this before, but the steps of a traditional gram stain just involve taking the swab that we got a sample from over here, and then we smear it on this microscopic slide, and then we add a series of several drops. So that would be one of the drops, and then over time we would wash it and add this drop as well, and this would help us visualize if the chlamydia bacteria are actually present here. But the problem is that chlamydia, because it's an intracellular organism, it likes to stay within cells, it's hard to see with a traditional gram stain. So this test isn't often used anymore. Another test that can be done is to take the sample from our swab and put it on this petri dish. So I'll draw this sample being swabbed on this petri dish, and we let it sit and grow for about 5 days. So 5 days. And after 5 days, we would see that our petri dish here would start to grow some colonies of the chlamydia. So I'll draw a couple of these colonies all over here. And that's how we could figure out that this bug is growing in our patient. But as you noticed, this test takes too long. It takes too long for us to get a conclusive diagnosis, which is why we've elected to use faster techniques nowadays. So after we've made our diagnosis, how do we treat chlamydia? Well, the mainstay of treatment will be antibiotics. Antibiotics. And to skip back a little, we can use this, and I forgot to label it here, we can use this culture test, or this culture, to help us figure out what antibiotics would work best against chlamydia. And we do that by smearing one antibiotic, say, down here, and then a separate or a second antibiotic, number 2, up there. So when we look at our culture 5 days later, we'll see that where antibiotic 2 was, there are some chlamydia colonies that are growing out. So it doesn't look like that antibiotic works very well to kill off the chlamydia. Instead, antibiotic number 1, which we put over here, has a gap of colonies. There are no colonies growing around where we smeared it. So that's how we can figure out antibiotic sensitivity for the bacteria and do targeted therapy. So I'll just write up here, we can target sensitivity. And then finally, maybe we can catch a person before they get chlamydia. And what can we do to help people prevent having the disease in the first place? So steps for prevention. And with any infectious disease, the way to do that is to stop transmission. So we need to stop the spreading of chlamydia from one infected person to another. And remember, there are several ways that we can transmit chlamydia, mainly through sex, and that can involve vaginal, anal, and oral sex. For all 3 of these, we can prevent transmission by using condoms. So that way we can decrease the amount of direct contact between an infected and an uninfected person. Another thing we can use specifically for oral sex are dental dams, with the same concept that we're decreasing direct contact. And finally, the last way we can transmit chlamydia is from an infected mother to her newborn child during childbirth. And the way we prevent this is just by treating mom, which is why all pregnant women in the United States are screened for chlamydia and gonorrhea on one of their first doctor's visits. And the main reason behind this is because 70% of infected women have no symptoms, which is kind of scary. It means that if a woman is pregnant and then delivers that child, it's very likely they can pass the infectious disease on to the baby without even knowing they had it, which is why it's really important to be checked and treated early on.